CAR T-cell therapy is a specialist treatment for certain types of cancer. While it has shown great promise in treating certain types of blood cancer, it can cause side effects. In this video, for those considering CAR-T, we'll be talking about two of the most common and potentially serious side effects of CAR T-cell therapy: cytokine release syndrome, CRS, and immune effector cell-associated neurotoxicity syndrome, also known as ICANS. Cytokine release syndrome, or CRS, is a potentially serious side effect of CAR T-cell therapy that can occur when the infused T-cells aggressively attack cancer cells in the body. Chemicals that are released cause inflammation and can lead to fever, chills, low blood pressure, difficulty breathing, and in serious cases, organ failure. Your nursing and medical team will monitor you closely, paying special attention to blood pressure, oxygen levels, and temperature. Most patients will experience mild forms of CRS and may need to have fluids given or oxygen, but for some it can be more serious and they need extra support for their breathing and blood pressure in the critical care department. CRS is treatable and can be reversed in almost all patients. The clinical team may prescribe medications that can help reduce inflammation and help patients feel better. Immune effector cell-associated neurotoxicity syndrome, or ICANS, is another potential side effect of CAR T-cell therapy. This is when the immune response triggered by the CAR T-cells causes inflammation affecting the brain. You may notice temporary difficulties reading, writing, or speaking, and this can progress to confusion, seizures, weakness, or unconsciousness in more serious cases. For most patients, this is mild and fully reversible with treatment. To monitor for this, you will be asked to answer basic questions, follow simple commands, and complete a handwriting assessment at least twice a day. This is called the ICE score. Completing the ICE score is quick and simple and indicates if you are developing any signs of ICANS. If you are about to undergo CAR T-cell therapy and have more questions about CRS or ICANS, please ask a medical professional within your CAR-T team. Whilst in hospital, it is important that you are closely monitored. Your healthcare team will make regular checks, including blood tests and observations. Daily bloods are required and may sometimes need to be taken from your arm as well as your central line. Observations for CRS and ICANS will take place at least twice a day, which may happen more frequently if you become unwell. As part of these observations, you will be asked to write a sentence and may be asked to do this several times a day. Your healthcare team will also measure how much urine is passed and how many fluids you are consuming or are given via a drip, alongside other checks such as monitoring your weight. You may be woken during the night for monitoring, but this is an important part of your care. If you experience any symptoms of CRS or ICANS at home, including a high fever, symptoms of an infection, feeling confused, or even just not quite right, it is important you contact your CAR-T team immediately. You may be recommended treatment with medications to manage symptoms and prevent complications. A member of your CAR-T team will discuss this in further detail as part of your discharge planning. CRS and ICANS are less likely from 28 days after CAR-T infusion. However, you may experience later side effects, particularly infections and low blood counts. Your medical team will advise on vaccinations and preventative medications to reduce the risk of infections, but you may need blood transfusions and other treatments where necessary. While CAR T-cell therapy can have side effects, your healthcare team will monitor you closely and provide appropriate care to manage any symptoms that may arise. If you have any questions or concerns about the side effects of CAR T-cell therapy, be sure to speak with your healthcare provider. Thank you for watching.